All right, so welcome back. It's still on the AM show. Let's talk about something that is quite worrying for all of us, childhood cancers. Now, I understand from our producer that Ghana records over 1,000 pediatric cancer cases every year. Those children, one of them could be yours. So if there is a way by which we can care for them, all of us must join it. And that's why it's with excitement that I'm welcoming into the studio Dr. Tanya Trippett. She is a pediatric oncologist and the president for Wish for Life. Hi.
It's a pleasure being here today. Thank you so much.
Great to pass through. What motivated, your decision to undertake this drive to care for children with cancers?
I think when you see children experience a disease that's life-threatening and they take it on full force and are resilient, and most importantly can be cured, then it really has been a source of inspiration for me to help in whatever way that I could possibly do.
Oh, so not just managed, they can be cured?
That can be cured.
Okay.
So in the United States and in Western Europe, we're looking at cure rates that are 85%. Of children that are diagnosed, complete treatment, are cured of their disease.
Oh.
So there's no reason why children in other countries who don't have the resources that we have cannot have the same access to the same quality of care. When you look at many of the low to middle income countries, the cure rates are much lower, so it's close to 20%. So these are diseases that children are dying from that we know how to cure. And so this is a part of our effort to just reach our hands out and across the ocean to provide a help and a resource and more importantly, a treatment center that we hope will help and change things.
So is it the affordability that is making places like ours have around 20% curability?
Sometimes it's access to the site. It may be a distance away from where the patient lives. Also the affordability for young families who are struggling with finances. It's hard to pay for the cost of the medicines and all of the resources that are required, to cure their illness.
So what does Wish for Life bring?
So what Wish for Life brings is a number of things. First of all, a facility that has the state-of-the-art equipment for diagnosis. Early detection is very, very important in establishing that high cure rate. So the earlier the cancer is detected in children, the more effective our ability to treat it is. And what Wish for Life will bring is the newer diagnostics into the region to make it accessible to all children, both in Ghana and also throughout the continent of Africa. In addition, we would bring newer medicines that are effective in treating cancer. And so we've joined in partnerships with a number of the pharmaceutical companies to bring those medicines into the region. And these are medicines that have been proven to be effective. We will bring that. And then, in addition, the resources for support of family members, residential facilities, to support the family at the site. So if they live a long distance away, they can live on the campus and just walk to receive treatment every day. And then have that emotional support system that's necessary to help them for the child to heal and for the family to stay intact. And then in addition, we have started a endowment in the United States to begin to look at offsetting the cost of care for children. And so we'll partner with, obviously, the government with the National Health Insurance Scheme, which is now supporting all children with pediatric cancers, but we'll provide an extra support on top of that to help families that need it the most.
So I get the impression that when the center is built, children who be coming there would not have to cough up the monies that would require.
That's the plan. That's the plan. And so what we'd be looking at is a mixture of support. We've created, in addition, a special microinsurance that is specifically for pediatric cancer that we'd like to roll out and initiate. And in addition to that, support for families that just can't afford coverage for their health care, but at the same time need those resources.
So nobody should be left out.
That's the most important thing. No one should be left out.
I'm told you're now going to construct the center.
Yes, that's correct. So we're in the first stage. We'll be moving now to the enabling works phase, which is utilizing the land that has been given to us from the Achem Nation. And what we'll begin to do is just start to clear and put the fencing around. So we'll start that shortly after this week.
Oh, but what is the challenge confronting? I mean, you've mentioned the money aspect of it, but when you take out money, what is that challenge confronting the treatment of childhood cancer in Ghana?
You know, the biggest challenge, and it's the same as in the U.S., is awareness of persons being aware that children can experience cancer, to remove the stigma that's associated with it, which it's not a disease that is caused by doing something wrong or also by it being contagious, but removing the stigma. And then the other big challenge is infrastructure. In order to establish high cure rates, it means that the equipment, the medicines, the whole infrastructure has to be there in full capacity. And that's the biggest challenge, is creating the facility and the resources to be able to maintain it over time, to make it sustainable over time.
Okay. And is this sustainable?
So this is what we're working on. We've united and joined hands with some of the major companies throughout the world. And we've asked them to be a partner. And by being a partner, that means helping to advocate for childhood cancer and supporting us in education, helping us with resources and equipment that we'll need. And then in addition, widening the visibility so that we have access to the full support. We're also engaging the business community throughout the world. We have a number of business associates in the United States, also in Europe and in Ghana and throughout Africa. We're helping to support us to look at economic strategies and models that will help to make the hospital come to fruition and be affordable and sustainable.
Sometimes they say prevention is better than cure, right? Is there a way? You know,
the tough part about childhood cancer is completely different than an adult cancer.
Okay.
Adult cancers are oftentimes stimulated by the lifestyle that you have. In children, the cancers are completely different. So we know that they can occur spontaneously. We don't know exactly the reason why, but it's not based on lifestyle.
Okay.
Oftentimes it's based upon the genetics, what triggers changes in normal cells to act like cancer cells. And the cells that pediatric cancers arise from are similar to the tissue of a child when they're inside of the womb of the mother. And those cells grow very rapidly. The same happens with pediatric cancer. So we're still studying, trying to understand the reason why these cancers occur. And then more importantly, targeting medicines that are specific to each child's cancer. And we call that personalized medicine.
Okay. Because sometimes we see adverts of young children needing around $200,000 to go through, a certain treatment.
That's right.
And all of this, with the establishment of the center, will be taken care of.
Yeah. What we'll be working on is reducing those costs. So a number of the ways that we're looking at this issue is making the center a nonprofit institution. So that reduces the cost of care. In addition, outside of the United States, the cost is cheaper for delivery of medicines. The cost of medicines is much cheaper. Also utilizing state-of-the-art equipment here in the country at the rates that the country is presently needing is actually far more cheaper than in the United States.
Oh, really?
So you're looking at, on the average, in the published data from here, $9,400 is the cost. When you look at the comparator in the United States, it could start at $150,000 and increase.
Oh,
so it's a big difference. And so we see that as an important distinction that we should make, that these are diseases that are curable, but also affordable. And so we'll look to make that happen.
Okay, I pray it happens. As we are on the show today, if maybe businesses are watching, what should be the role that all of us should play in making this possible?
I think what we need is the resources and the know-how to look at an economic model that's effective. with multiple strategies, multiple revenue streams that will come in. We need both the knowledge and also the financial support. So we're looking for partners that will want to join in. And what we would ask them to do is to have a heart for children first. Secondly, to help us to use the business knowledge that they've used to increase their revenue so that we can look at an effective way of managing the revenue so that all children can be treated. And then finally, I think that giving a hands-on approach is really important. Getting involved in the center, adopting some of the portions of the center, and making sure that it's sustained over time.
Okay.
So creating those relationships within the community that are grounded within the economic community.
And once the center is set up, then, like you said, awareness creation to draw even the people who are farther off in the hinterlands to know that there's something like that so they can take advantage of.
Yes.
Do we anticipate the number of children we can take care of in a year?
So in a year, we're looking at the bed capacity is 100 beds, but we have outpatient facilities for residents, and it's 160 beds that will have so close to 300 children per year at the center. Our plan is over a period of 3 to 5 years that we escalate those numbers.
Okay.
So we'll increase the bed capacity by further growth of the center to 250, and then we'll expand the residential facilities. So what we would like to do is to be able to offer services not only to patients in Ghana, but looking at Nigeria, Benin, Togo, the surrounding regions, and having an access that's an international access to care that would be available. So this is why we need the community support in the business.
Okay. So when are we looking at this coming to life?
So we will push to start construction at the beginning of the year of 2024 with a 2-year plan for build.
Okay.
So 2026.
It will be operational.
Yes.
All right. I guess we'll be with you along the step, every step of the way, so that people will get to know where we are with this, because this is quite miraculous, right? If I have to spend $100,000, and with this, I may probably end up spending zero. That's a miracle.
That's the goal.
Yeah.
That's the goal. And if I can finish my career with, I wanted to finish my career doing what I love without being paid, but more importantly, providing that access to all children.
Okay.
All of my children in the United States, if they've survived their illness and those that have not, have never wanted another child to experience what they've experienced.
Oh.
And so that's why we call it the Wish for Life Foundation.
Oh, okay.
So it's a wish for all children on behalf of our world's children to not experience cancer, or if they do, to be cured.
Okay, interesting. And so you wish to spend the rest of, when you retire, you'd be in Ghana to do this?
Yes, that's for sure. I'll be back and forth.
Oh, you love Ghana, huh?
I love it.
Okay, that's for coming through, yeah?
And thank you for having me.
And all the best. But before we go, probably if you have a last word for those who are watching us?
Sure. What I would say to everyone is no child should be denied the chance for cure of their cancer. If we have it within our power to unite our collective voice and to share our alliances to make this happen, this is the most important thing.
Okay. Dr. Tanya Trippett, thanks for coming.
Thank you for having me.
And all the best.
I appreciate it. Thank you.
All right.
Thank you.
This is a worthy cause that all of us should support. If you're out there and you can support them, I'm sure you have to get in touch with them so that we can all come together and make this a reality. If someone wants to connect with you, how does the person do it?
So if you look at our website, www.wishforlife.org, there's a way that you can access and send a message to us, and we'll be responding quickly. And we have a leadership team that will be reaching out to the community, also giving access here to how we can work together.
All right. Thank you so much.
Thank you so much again.
Well, so kindly get in touch with the Wish for Life Foundation and let us all come together to see what we can do. Well, yesterday we began a certain conversation that really struck me. When I got to hear that, I never imagined that there's a forest somewhere that someone may be in doing illegal mining now. But we are told that there are a lot of forests in Ghana that people are mining illegally in them. And when you see the video that we showed you yesterday, it will prick your conscience that something ought to happen in this country. We have that conversation coming up next here after this.